Good afternoon. My name is Brian Singleton, and I'm going to discuss the comparison of the United States healthcare system versus the governmental system of Africa. Of Africa. When I first started out, I would like to talk about what is health. Health is a state of complete physical and mental and social being, as defined by the World Health Organization. Some of those determinants for health is your lifestyle, exercise, diet, and sexual activities are direct influences of your health. Well, in the United States, our health uh, right now, as Americans, the majority of Americans are not considered obese um, due to the fact of being overweight, or we can say as being a wealthy country, that we are able to eat different foods at any given choice and have those foods of choice and leisure at any given time. Um, well, over in Africa, that is not a option for them. For the majority of the country, the different parts of the country are is going through famines or stress where they're not getting the proper diet or proper exercise. The lifestyle changes are all determined by what's going on in their country. And right now, they are dealing with a lot of even their ingrown, or as you call homegrown physicians, are leaving Africa to go to America or Great Britain for different reasons. One of the biggest reasons is compensation. As we know in America, our compensation for our doctors is very high. So they are very African students are, the ones that are even learning about healthcare and getting their doctor's degrees from their own country are leaving, which the government is having issues with today because they need those doctors to stay in to help fund the system. So, with that being said, that's part of the issues that's going on in Africa about how to keep their people healthy. When we talk about preventions of health and the three different prevention areas in health is your primary prevention, which avoids the development of a disease, promotion such as the education and our primary preventions. Excuse me. Secondary activities are focused on early disease detection, which prevents the progression of a disease, which is your screening programs, high blood pressure screening, different disease screening, AIDS screening. Um, these are the things that we do in our secondary and territory, excuse me, focuses on the rehabilitation and the monitoring of disease of an individual, such as taking those that are on high blood pressure medicines. These are the things that they do. Here in America, we have that is kind of rampant compared to um, Africa. When I say rampant, I mean we look at we look at America and we think that we're not doing enough to prevent. Um, I am very big on the prevention stage. I'm very pro prevention here in America. Excuse me, pro prevention for our healthcare system, which would aid in the reduction of severe illnesses if more Americans would take their time to have prevention or go to prevention or just get their yearly checkups. Well, in Africa, their yearly checkups you might get a yearly checkup every 2 years um, because of certain areas. Unless you are private in the private sector or you have your own private insurance, then the prevention stages are not as well organized in the country of Africa. There's different little areas that may have those things set up, but it has to be funded through private sector where you have to get your own private insurance. Um, as we go to my next slide, which is the governmental roles, the United States government focuses on the organizations and actions that impact individual safety, which is our health. In Africa's government, the government has too many different challenges um, to deal with, and since it's a single payer system over there for the government part, then they're not able to control the actions of everyone. This is why they have the issues that they're having now, because it's not funded as well, because it's a poor, the most of the majority of the country is a poor country. So they're not having people to pay into the system, which they're not able to afford to give the health care that is needed. This is why we have a lot of foreign aid going into Africa for healthcare. A lot of people are raising money to help the healthcare system of Africa because of the government system and the private sections that are not the private people are not able to afford all the private um, in the to afford private practices. Um, my next slide is the public health uh, infrastructure. The United States public health activities are developed by many organizations and government agencies at the federal, state, and local levels, and some non-governmental organizations, so that the United States has many people. We have private and public working on healthcare. Um, Africa, the most of theirs is run by the government, and the government is not really spending much money on their system to provide health care. It is actually if you don't have private insurance in the country, then you are really not going to be insured. You're not going to be able to take care of yourself. You're not going to, if you are treated, because the systems and different things are running rampant, over different diseases are going on, and the biggest one is just getting food. You're not able to have the public food that you need to have to be healthy. You're not able to get the vegetables or eat healthy as you go along. Um, so the government of Africa is really trying to manage its healthcare system, its governmental systems. Um, the people are in turmoil as you go through and as we learn about the country of Africa. So that has a lot to do with why they don't take healthcare as important as we do in America. And in America, we take the healthcare to be something very serious. Almost, it is one of our guaranteed rights that people assume that this is what we have the right to be healthy or the right to choose not to be healthy. That is not so in the country of Africa. The United States, um, the the financing, which is a big issue of healthcare, and as we talk about the Affordable Care Act, how do you finance that system? Well, being financed through that system is through different taxes and insurance premiums. That is what here in America that pretty much finances our healthcare system. Africa is not that way. The system, um, as we know, the American system, the GDP for American healthcare is way above 25%. Uh, in Africa is less than 5 throughout the majority of the country. Um, Different states in America have tried their own system to be state run and state funded to make their systems better and healthier for their people, but this is what we have today. This is what we're using now. The Affordable Care Act came along, and uh, we can go all the way back to President Clinton as he was trying to put the system together. That didn't get done as he was president, and then President Barack Obama did get it completed and funded. Um, but the part to that now is, it was to save us at least $100 billion over out of the deficit over a 10-year period. But as we found out, trying to switch a system and bringing in 26 million people more into the healthcare system that never had insurance. Um, Now, and we're thinking that the thought behind that was the more people that came in, the more premiums that could be raised to fund the system. That still didn't happen because when you expanded out Medicare and Medicaid, that was still being ran by the state or the federal government, which continued to put a bigger drag on our economy. So, in conclusion, um, not at all lost for Africa with their healthcare system. There are many people, including America, that is going to their aid to help them get their get the healthcare back up to what we call standard code, which is help them out. And with the United States, there's still room for improvement on how we fund our government, how we can curtail the cost so that the healthcare cost does not continue to increase as we have seen over the years, where it continues to increase and increase. And some people are wondering, like myself, will we ever stop? Will healthcare ever come to a norm that we are? But being healthcare in America being a very big business and very big part of our gross domestic product, then it's going to continue to rise. Thank you for your time.